The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, what you need to know if you're considering bioidentical hormone replacement therapy. With us, we have an expert on the topic, Dr. Ann Peters. Dr. Peters, welcome to the program.
Nice for having me, Randy.
Now, a very interesting topic, and before we get into it, let's talk a little bit about your center, or centers. You have a few. Tell me about it.
Yes. I have one in New York, which I'm going to start pretty soon. I have one in Gold River, California, and another in San Francisco.
Okay, now, by the way, what do you call it? What kind of medicine is this? Is it holistic medicine, anti-aging medicine?
Well,
what do you call it?
There's all names for this, but what I like to call this is age management medicine.
Age management medicine.
Yes, so you function and feel the best you possibly can.
Now, you have a saying, and I like what you said. You said, in fact, it's on your website, feel well, look well, live well. Expand on that.
Yeah. Feel well. So, it's more of function. So you feel, you could perform the way you would like to when you're in your 20s and 30s. And look well. A lot of my patients do aesthetic procedures to look younger and
so they've had cosmetic
more
surgery.
Youthful. Yes. So then this is.
But they feel old.
That's right. So this is.
Is that right? Did they tell you that?
Oh yes, certainly. So they feel they look well, but they want to function and perform that matches the way they look.
Okay.
And of course, so that they could do the activities they love doing in their 20s and 30s.
Now, for people just tuning in, we're talking about bioidentical hormone replacement therapy, but as you call it, Dr. Peters calls it hormone optimization. You say it's not just about hormones, though.
That's correct.
For longevity.
Certainly, it's important. Nutrition, very important. Fitness or exercise. Then we have critical supplements, vitamins that are crucial to our well-being, and also stress reduction. So that, together with hormone therapy, I would say completes the package of someone.
How soon can the patient start feeling better?
Oh, that's a good question. Probably, I have my patients tell me in 2 weeks maximum, they already notice a difference, more energy, more endurance. They have a better outlook on life. So,
really?
So they are very happy people, yes.
Is it more men than women or more women than men?
Well, initially I used to have more women because they used to bring their husbands in, their significant others in. Now I have more men, actually, that come in to see me, and they start bringing their wives in.
And
so I would say
edge.
half and half.
Both people want that.
Oh,
they want to feel great.
Oh,
is it true the number one reason why people go to medical doctors is lack of energy?
Oh, definitely. Lack of energy, endurance. They are not as motivated as they used to be. They don't have that edge.
You say that they get more energy. But scientifically, what's going on? Why with hormones and putting it all together? I mean, what's going on physiologically that makes it more energy?
Well, let me tell you this. All the hormones that we naturally were born with, right? Meaning testosterone, growth hormone, thyroid, we all have receptor sites on every organ of our body. Okay? Now, as we age, our hormones decline. Okay, so
as you get older, the hormones start going down.
That's correct.
In everyone.
That's correct. That's correct. So as we replace them, we function better, because when we were in 30s, our hormones levels were much higher than it is when we
when you say
are in our
replace,
50s.
Are you talking about replenishing them in a way?
Replenishing, supplementing.
So by giving them back.
Yes, exactly.
They start feeling the way they
Certainly, supplementing your hormones, optimizing them to the optimal range.
Do you think you're slowing the aging process?
Certainly, yes. Yeah, we're slowing the onset of age-related diseases, by optimizing your hormones, and that means optimizing your endocrine support, right, so that you feel and function better. I'll tell you that, I have couples that come into my practice, and the level of the male testosterone, or actually the male estrogen, is higher than the female estrogen, right? And that's why we have andropause. The decrease of the testosterone in men. And the increase in estrogen is the problem.
So how do you lower estrogen in men?
Yeah, so we have quite a few things. We have a way to do it clinically. We do it by an enzyme inhibitor that prevents the conversion, too much of the conversion of testosterone to estrogen. and you know, we get the ratio of your testosterone to estrogen just right, so that you don't have things like enlarged breasts, you know, in men as they get older, abdominal girth increases.
Do they lose weight on your program as well?
Oh,
as a side effect? I mean,
certainly.
They go to you to feel better, but
that's part of the whole process. Yes.
Okay.
Because as you optimize your hormones, you gain or maintain your lean muscle mass, and you lose fat. Okay. So you fit better in your clothes, and you feel better. Yes.
Okay. 3 things you say: nutrition, fitness, bioidentical hormones. I want to talk about the commonly replaced hormones, but you also have 3 different types of programs.
Yes. Yes.
Within your practice.
Certainly, yes. The first program is hormone replacement program, where I replenish all the hormones, the critical hormones, except growth hormone. Okay, and then there's a second program which is called the age management program, where patients could avail themselves of all the hormones, including growth hormone.
And then your third program?
The third program is a consulting program to patients who not only want to avail themselves of the, inclusive of the first 2 I mentioned, which is all your hormones plus growth hormone, but genomic testing, meaning that we want to look at genetic predispositions to diseases to prevent them. So
these are for people that really want to take it up
to the next level. Yes, yes.
Okay, genomic testing,
so
you say?
Genomic testing, we have stem cell banking for those who want to use this in the future. We look at all organ systems. So if you have a family, history of a certain
like breast cancer
disease,
or whatever,
breast cancer or heart disease, or any sort of cancers, we try to find out whether you are prone to having that, and be very aggressive in therapies to prevent this from happening, because you don't want to follow those footsteps.
I mean, you have a chart that shows your progress. So you show this to your patients. What are we looking at?
Well, here's what I show my patients, that these are all the different hormones here. And you could see just a cumulative look at what the levels could do over a period of years.
With testosterone, in 08, they were at that level.
That level. And then,
so the numbers on the left are missing.
That's right.
For this, okay.
So this is the change that could occur over a year.
Is that too high, though? That seems like a pretty high bar.
No, it's not too high at all, because first of all, we don't see the numbers here. Somebody could start with a testosterone of 300, a male, but the optimal is around 700 to 800.
So everybody should get tested, though. Everybody should know, like every man watching this should know what their testosterone numbers are.
Definitely.
Or woman.
Definitely.
But women really need testosterone?
Definitely. Oh, really? Yes. Women have also low libido, so they could benefit from testosterone. Not only libido, but cardiac function, because we have receptors for testosterone on our heart muscle. So we function better, and our heart muscle.
Is that one of the reasons why you have more energy?
Oh, definitely.
With testosterone?
Yes. And how about the lungs? You have greater lung capacity, so you could perform better if you optimize these hormones.
So all of this, okay, so I understand this correctly. They come in, you do your evaluation, do some blood work, take care of their nutrition, get them exercising, the smart kind of right kind of exercise.
Certainly.
Hormone optimization. And then you retest, and then you show them this chart.
That's correct.
Okay.
That's correct. And then invariably, all my patients, this is the progress I see, where the levels increase, over time.
How often do you test?
I test periodically. In the beginning, maybe the first month, then then third month out from the start, and then every 6 months or so. Now, if a patient is doing very well and they have optimized their hormones and they feel great, then I do it maybe every 10 months, 10, 11 months or so. So but it's a matter of periodic monitoring and keeping your levels where you feel your best at, all the time.
So you say this is a holistic approach to aging.
Yes. So when I say that, I mean that we do not rely on pharmaceuticals, in drugs to feel better. We do things that we should naturally be doing in the first place to prevent diseases.
So that, as you say, so I understand this correctly. There's diseases associated with aging.
Yes.
Like diabetes, heart disease, things like that.
Every disease.
Okay. You're saying you can push that out. You're convinced.
Oh, certainly.
That you could push that out.
No question.
Farther out.
No question.
Really? Is there science behind any of this?
This is all evidence-based medicine, all science-based medicine. All the clinical medical journals in America, in Europe, have
when you hear
that.
Somebody say, and my father, and I'm talking about you before the interview,